Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as Desvenlafaxine. Its brand name is Pristiq. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Desvenlafaxine is a potent, selective serotonin and norepinephrine reuptake inhibitor. It potentiates these neurotransmitters' activity in the central nervous system. Desvenlafaxine is the major metabolite of venlafaxine, which is also used in the treatment of major depressive disorder. So the indication for use for desvenlafaxine is for major depressive disorder. Before somebody was to use the medication, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. The use of this medication is contraindicated in individuals who have used a monoamine oxidase inhibitor in the previous 14 days. If an individual was to use desvenlafaxine with an MAOI, such as linezolide or IV methylene blue, they would be at an increased risk of experiencing serotonin syndrome. The last thing to worry about in terms of contraindications would be if an individual had a hypersensitivity to desvenlafaxine or to venlafaxine. We should avoid use of this medication in the elderly population who have a history of falls and fractures, unless other safer alternatives are not available to these patients, as this would put them at an increased risk of experiencing ataxia, syncope, impaired motor function, and this could result in additional falls. Some patients may experience an increase in blood pressure while they use desvenlafaxine, so in certain patients that have cardiovascular disease, they should be monitored extra closely. It's a good idea to make sure that patients have their blood pressure stabilized or under control before they start using desvenlafaxine. There is an increased risk in bleeding in individuals who use desvenlafaxine. This would be more common if they're also using NSAIDs or aspirin or something like warfarin. Seizures have been reported with the use of this medication. Clinical worsening of depression, as well as suicidality and unusual changes in behavior have been reported with patients of all ages with this medication. It is more common, however, upon initiation of therapy. If patients use this medication who have bipolar disorder, they may be at an increased risk of experiencing mania. Interstitial lung disease, as well as eosinophilic pneumonia, have both been reported with racemic venlafaxine mixtures. Serotonin syndrome is a risk with this medication. As I kind of touched on earlier, they would be at more of a risk of experiencing this syndrome if they're using other medications that alter serotonin as well. Serious discontinuation syndromes have been reported after abrupt discontinuation of this medication, so it should be stopped slowly over time if a patient does choose to come off of it. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Pristiq, they can expect to take it in tablet form. It is available as a 50 and 100 milligram extended release tablet. When this medication is being used for its indication, that is major depressive disorder, typically patients would take 50 milligrams once daily at the same time each day. Because these tablets are extended release tablets, it's important not to crush, split, chew, or alter the tablets in any way. One off-label use where we see this medication used would be for menopausal flushing, and in this situation, they would typically use 100 milligrams once daily. Medication can be taken with or without food, as food does not alter absorption. Now, like most medications, there are some adverse reactions or side effects that patients may experience while using desvenlafaxine, so I'll go over some of those here with you now. Diaphoresis happens between 10 and 21% of the time. 3 to 10% of people can see an elevation in their cholesterol levels, and 1 to 6% of patients can see the same with their triglycerides. Constipation happens from 9 to 14% of the time, and 5 to 10% of patients notice a decrease in appetite. 22 to 41% of patients experience nausea, and only about 3 to 9% of patients experience vomiting. Dizziness can happen up to 16% of the time. Insomnia comes in at 15%, somnolence at 12%. Blurred vision can happen 3 or 4% of the time. Anywhere from 0.7 to 2.3% of patients may experience hypertension. Some rare but serious side effects would be anaphylaxis, an upper gastrointestinal hemorrhage, hyponatremia, or a seizure. A seizure would happen less than 2% of the time. And lastly, angioedema happens less than 2% of the time as well. That's all we're going to talk about today with the Desvenlafaxine, or Pristiq. As always, I'm thankful that you took the time to come by and watch one of my videos. If you would like to help grow this channel, you can do so by liking the videos, sharing the videos, or most importantly, subscribing to the YouTube channel. That's it for today. Take care.